Welcome to the Optimal Bio podcast. At Optimal Bio, we don't just balance your hormones, we balance your whole body. Our conversations range from nutrition to medicine with an emphasis on wellness tips to support your health journey. If you like what you hear, find us on the web at optimalbio.com and follow the podcast so you don't miss an episode.
Welcome everybody to another edition of Optimal Bio Wellness Podcast. Today we want to introduce you to a new member of our team, Johnny Moody. He's been with us for I think a little bit over a month at this point in time and primarily works out of our Charlotte location. And to get started, Johnny, I'm going to kick it back to you. And if you wouldn't mind just giving our audience, a 5-minute overview of your background and how you got to where you are.
Okay. Thank you, Jim, for having me today, this afternoon. And I'm Johnny Moody. I'm a family nurse practitioner. I've been practicing for about a decade as a family nurse practitioner, primarily in urgent care, emergency medicine, and some primary care too. So I'm really excited to be here and be doing functional holistic medicine now. Excited to be here.
Man, you spun through that pretty quick. So let's go back in time. Where'd you grow up? Where did you have a desire when you were, 11 or 12 or 20 or 18 to, get into the healthcare field?
Yeah, I did. I grew up actually in Western North Carolina, spent most of my time in Asheville, where I was born. But I did move around a little bit, was raised by a single mother, hardworking mom, amazing woman who worked in a factory to provide for me. And I was very blessed to have her. Amazing woman. But we moved to some of my fondest memories growing up. We moved to a place called Spilcore, North Carolina, which is in Madison County. And during that time, had 9 tobacco fields that we worked. So we were hardworking, kind of on the farm. And it was a very interesting and fun way to grow up. So in my spare time back then, I would ride my dirt bike over to the border of Tennessee and get a moon pie and a Coke and then ride back. And that would be my day. So it's pretty cool to grow up that way and raising tobacco. That was a major cash crop in that area in Western North Carolina way back when. It was just a great experience looking back on it. A lot of hard work, a lot of long nights, played a lot of sports too. So just very fortunate to have that in my background.
So were you actually working the fields?
Yeah. So we'd actually raise it from start to finish. And at the end of the year, we'd use our cash crops to do what we wanted to and then kind of help provide for our family. But that's how I was able to afford my dirt bike. So I raised my money that way and got my dirt bike. It's a pretty proud moment for me when I was about 10. So it's pretty cool. So
kind of walk us through the that farming process. I knew a guy who owned actually the tobacco warehouses in Durham, and they would obviously by rail, a lot of the stuff would come in, they'd process everything, and then lease space out to the cigarette companies at the time and everything else. So, I've heard about picking cotton. I've heard about farming other crops and what have you, but kind of walk us through the tobacco process.
Yeah, so you start out in the mountains. So you find some flat land. Usually that's near what we call a bottom beside the river. And you have to prepare the soil. So you have to pull all the rocks and all the stuff out of it. So it's a lot of work to do that just to get the field prepared. And then obviously we plant it. And we plant it as it grows. What we call, keeping the weeds out of it and stuff like that. It's a lot of work. It's a continuous process until it gets tall enough to where you cut it. And then you cut it and put it on sticks, and then you hang it up into the barns to cure. And then over a period of time, it dries out and cures. And then we take that down and actually take the leaves off by hand and then pack them down into a bale and then bale it up. And then we would take it to Asheville, and that's where they'd weigh it and sell it. It's a year-long process.
So is it kind of like corn? Like once you cut it, that's it for the actual plant itself?
Yeah.
Okay. So it doesn't regenerate, in year 2 or year 3 or what have you.
They got started all over again. We start with small little plants, and we take those plants and we transplant that to the actual field. And we used a tractor with this big kind of wheel thing, and you put it in the back of the wheel behind the tractor, and it would plant it, and then we walk behind it and make sure that it was planted properly.
And then what was your job as you explained this whole process to the audience?
I did everything. So, as a little boy, I just had to do it all. So it was good.
So was the goal to drive that tractor as opposed to being on the ground? And
never got to drive the tractor. I wasn't big enough to do that yet, but never graduated to that. But everything else.
Well, I always heard stories about people living in the mountains. They're driving cars and machinery at 10 years old, and the rest of us that are more in the suburbs are we got to wait till we're 16 or 17.
That is true. We do most of that stuff for sure.
But then again, you had a motorbike at what, 11 or 12?
I did, yeah, and ride it all day long.
Yeah, that's pretty cool. Okay, so you do that, and then you're in high school at this point in time. You get a little bit older, and you said you played some sports. So what were you playing?
Yeah, I was playing baseball, football, and basketball in high school. Moved back to Asheville, to the city of Asheville, and actually played there. And always had the thought process I go to college and play college sports, and that's what I ended up doing. I went to a small college, Newberry, in South Carolina for football, and realized pretty rapidly that, hey, I'm not really the biggest, fastest, strongest here. So I ended up leaving Newberry and joined the United States Marine Corps in 1996. And I enlisted as an infantryman.
So you took the hard way in.
I sure did. Absolutely. But I learned a lot, and that hard work ethic back in Spilcorn, North Carolina, kind of made boot camp pretty easy for me, actually. So it was good to grow up that way. After the Marine Corps, I got out and was going back to college at Western Carolina University up in Cullowhee, Western North Carolina. And a friend of mine called me up and said, hey, have you ever thought about being a firefighter? And I said, well, yeah, I remember that show back in the early 80s, maybe late 70s, Emergency. You remember that show? It was on TV. I was like, yeah. I remember that being pretty cool. So, yeah, that sounds like something I'd like to do. So I applied, and out of 300 applicants, they selected 10 and became a firefighter for the city of Asheville, and did that for a number of years. And that's where I fell in love with medicine. I was fortunate enough to be part of a team that had a full successful cardiac arrest that came back, and really cool experience. We went for a first response call. This lady was down. Get there, and there was a nurse who was already doing chest compressions on the ladies, which was great. So we took over. We intubated her. We defibrillated her, took her to the hospital. And the guys on the bus or the ambulance came back to the station later on that afternoon and said, hey, she might make it. And so a number of months later at the firehouse, and the little buzzer rings of somebody at the front door. And it's this wonderful, wonderful lady coming and brought us a cake. She baked us a cake and brought it to us. So that was a special moment in my life. And that's when I realized I definitely wanted to go into medicine. And so shortly after that, I applied to nursing school and went that route.
It's a pretty cool story. So you weren't doing anything medical when you were in the Marines?
No, in the Marine Corps, I was infantry. And in the Marine Corps, we're a department of the Navy. And so the Navy has corpsmen, and one of our nurse practitioners in Charlottesville was a corpsman. And so there are two different types of corpsmen. They're what we call green corpsmen, and they're a hospital corpsman. The green corpsman would be attached to an infantry platoon or an infantry unit, and they would follow us and be with us the whole time. So we're out in the field, and we're doing our maneuvers and fire and all that kind of stuff. And the corpsman is with us, and so the corpsman is doing everything we're doing. Also has the knowledge base to take care of us if something crazy goes off, and they're also carrying an extremely heavy load of equipment because they have all the medical equipment, everything they need. So I always really looked up to them, the men and women that were with us, and I always thought, wow, that's something really cool that. They're pretty locked on. They're pretty squared away.
So you obviously were there during 9/11 then, correct?
Yeah, during 9/11, I actually was in the reserve component at that point,
Okay.
and I was a professional firefighter. And I remember I was at Station 5 in Asheville, and the tones went off, and all the chiefs came over and said, "Hey, we want you to watch this, how they put out this high-rise fire." I mean, everybody knows where they're at that day. I'm sure you do too. But they thought initially that a plane had, it just kind of ran into the building, wasn't sure what to do, or wasn't anything malicious at that point. And so we were just watching them to see how they put that big, huge fire out at those top levels. And so we were watching that when we watched the second plane hit. It's a pretty remarkable experience in everyone's lives, but being a firefighter and watching it happen, it was pretty remarkable.
Yeah, it's almost surreal because when you were watching it, and to your point, I remember where I was too, and then you turn it on, you're watching, and the first tower just literally collapses on itself straight down, doesn't lean one way or the other way, and the second tower, the same thing, half an hour later, and you just from where you're seeing it on TV, it doesn't look real because you just can't fathom that there's thousands of people still in the building. There's people around the building. And then you see pictures later on of, all the people kind of walking uptown basically. And, they're all disheveled and, you can't see 1 foot in front of you and everything else. As a firefighter though, I mean, after that happened, did you think about, what would have been like to be in that circumstance as well?
Absolutely. If you don't think that way, then there's probably something wrong with you. But, it was a horrendous part of our history, but a learning experience for us all as firefighters on how to deal with that kind of situation. You're never going to be prepared for anything like that. But at least we did learn some things from it. And we took it on and developed some SOPs in our city and our municipality related to that. Just a crazy experience in our life.
So before that to after, with your point about the SOPs, what are some of the minor things that are bigger things that changed, post 9/11?
We used to use an old kind of a dragger bottle pack that didn't have its oxygen tank. It's a self-contained breathing apparatus. It was a bigger, bulkier thing that didn't last as long. And so we switched to Scott packs after that. We also focused more training on having all your gear on and going up X amount of flights of stairs and hooking into standpipes and stuff in the facility. So all that stuff kind of changed rapidly. So, sometimes we were having some days where we'd sit there, be playing ping pong, and next thing you know, they're like, we're training. And so we trained a whole lot more and a lot harder, and we all grew because of that.
Yeah, it must have been tough too at the time because, obviously with your training, you're in effect, requiring a much stronger physical, component, to being a firefighter. And, were there some guys and ladies for that matter, that simply just couldn't make it and they had to drop out?
Yeah, we had a pretty rigorous training academy. It was a 6-month academy. It was actually, in my opinion, harder than boot camp. 6 months long, start early, and you're getting it all day long. And you're doing nothing but training exercises all day long. I mean, it's really a big time weed out process. And so if they didn't make it through that rookie academy, we kind of weeded that stuff out prior to that. So once we're online, you call it, and we're out there actually doing our job, but all those men and women are pretty good to go.
Mm-hmm. So unlike nothing against police, but the police force, where once you're through the academy and then you're doing your thing, you're getting the free donuts at the coffee shop in the morning and everything else. Firefighters don't have that luxury.
Oh, they do a lot of training too. We need them, man. They're amazing.
No, I'm not disparaging them. Sounds good. All right. So you're doing this and then you decide you're going to go back to school. And What was the education? What was the school, situation like for you?
Yeah, so I moved. That's when I moved to Charlotte and was going to UNC Charlotte for nursing, and actually transferred to Mercy School of Nursing. Mercy School of Nursing at the time had 100% NCLEX pass rate, so they were a better school per se on paper. And so I transferred there, got my nursing degree from Mercy, and then transferred back to UNCC and got my bachelor's. And at that time, I was working and got my first job on 2 North, and it's what's now called Atrium at CMC at Mercy. And I was, this was pretty interesting. We had 11 or 12 beds in the back of our regular medical surgical floor that was medical detox. And so we serviced heroin, alcohol, benzodiazepines, all the pills and opiates. So it was a really, really big learning curve. It was a pretty good way to train. Then I rotated up to the medical intensive care unit and did medical intensive care and also emergency room. They kind of rotate us around, kind of where they needed us. And so it was really, really good experience.
At the time, I know it's changed now, but were you're probably one of the few males going through nursing school at that time. Is that a fair assessment?
That is fair. There were actually only 2 of us that graduated, with the rest being ladies. So that was interesting.
How was that?
It was interesting, and a lot of fun. So, and then especially being kind of, the old jarhead who's coming in to being a nurse, I kind of got razzed pretty good from my buddies and stuff, but it was great. It was fun. And then practitioner school was a whole nother ball game, a lot more in-depth pathophysiology and stuff like that. So it's pretty in-depth and a lot of work. And so once I got Go ahead.
What sparked you to become a practitioner?
Well, on 2 North at Mercy Hospital, I met a PA, a lovely PA, who ended up as my wife now. And she was, have you thought about doing this? And yeah, I have. So, we'll go that route. And so I met her and applied to practitioner school, and that's it.
So if you're in a general hospital, obviously all of us have been in the hospital at one point in time, visiting loved ones, hopefully, and not having to be there yourself. But how do you delineate between an NP and an RN, in that setting? Is the RN doing more the hands-on work and the NP is more the manager? Is that how you describe it, or?
Yeah, that's a good question, because when I first went to nursing school, I was a little bit confused by all the different titles and different parts of nursing. So you've got the RN, who really is running the floor. He or she is passing medications with the patient all day long. And then you have your FMPs, PAs, and MDs who come around and round on the patients and say, okay, but they're the ones who give orders. The FMP will give you the order to say, hey, this patient's mean atrial pressure is dropping. We need to give them some more pressure. So let's increase the vasopressor dose to X. And then the RN will go and actually carry that out, if that makes sense.
But for the average person like me, I couldn't tell who the NP is and the RN is. Right.
Right. Yeah. Well,
but you obviously get paid a little bit different. There's different responsibilities, which you just described. But, whereas obviously, you go in the hospital, you could tell who the doctor or the PAs are, compared to the nurses and the nurses' aides. So when you're getting advice from your future wife at the time and, you're going through the school, are you like me, like, hey, what's going to be the difference, when I get out, other than maybe a little bump in pay? Or do you know that, wow, I'm going to become a practitioner and, I'm focused and this is going to be great and I can see this career in front of me?
Yeah, so it's a big step forward. It's just a lot more responsibility because now you're a provider of medicine, and so you're responsible for not only knowing the ins and outs of the medication, but also the patient. And so you're actually you've got that prescriptive authority now, and so when you prescribe a medication, you better know what it's doing. You better know all the other medications the patient's on. Make sure there's no contraindications and no cross reactivities for anything that's going on with the patient. So it's just a lot more that you have to think about. Nursing is very labor intensive as an RN, as an FNP or PA or MD. It's not quite as labor intensive anymore, but it's a lot more to think about, a lot more responsibility. And so, it's just, it's been good.
Sure. So as a practitioner during that time, because you had been a nurse, are you listening to and seeking nursing input, more so than, let's say, a typical doctor might, as it relates to patients? Or, how would you describe yourself as a practitioner and in relation to providing the best possible care for the patient with a team of people?
Yeah, I think you definitely, if you've been there and done that kind of from the ground up, I actually started out as a CNA. I was working as a CNA in school. So you kind of appreciate what they do, and not the MDs or anyone else doesn't appreciate them. It's just they don't really know. As a CNA, you're running around, you've got not only the whole the section that you're in, but you got the whole floor, and you've got to do all the vital signs. You got to make sure all the vital signs are correct. You're measuring outputs, urinary inputs and outputs. You're making sure that there's just a lot of work. And so once you become a FNP and you've done those things, you just appreciate that a lot more. Just like anything else, if you're in a large company and you started out sweeping the floors, once you become the boss or whatever, the CEO, as in our case, right? If you're sweeping the floors when you start out, once you become the CEO, you appreciate that and you understand it more. You're like, hey, I know this is not fun, but this is why it's important, and you appreciate it a little bit more, I think.
Now that you've been in it for a while, and based on what you know, if you had the opportunity to change the practitioner educational program, would you keep it the same, or would you add things or take things out that would be more customizable to the actual practical, work you're doing as a practitioner?
Yeah, I think one of the big differences between a physician assistant and a nurse practitioner is that the physician assistant it's much more didactic, much more medicine based. As a nurse practitioner, we do a lot more theory and research. And so there's a lot more of that in our program, and that's important. I think theory and research is extremely important. You got to know what's up to date. Things change. Medicine is extremely malleable. What was, protocol 3 or 4 years ago is no longer protocol. So being an FNP, I felt like we got a lot more knowledge base on that. But I think maybe kind of combining those two together, and, my wife being a PA, I kind of get all the intricacies of kind of what she went through. I think if, as a nurse practitioner, if we had a little bit more didactic part of that, then I think that would help. And I think if PAs had a little bit more, the research and theory background, that might help too. As nurses, we kind of look at patients as the whole patient. We're kind of trained a little bit differently. Instead of looking at a pathology, okay, let's isolate that pathology. What can we do to fix that? But we also look at the whole patient, and like, how do you feel? Like, well, how do you feel with this? Or, it's a lot more mindful approach, I would think. So all aspects are great. There's strengths to this and there's strengths to that. But in that case, I think that, a combination of the two is important.
So as a practitioner, I don't know, you got any humor, funny stories, any really positive stories you want to share with the audience?
Yeah, absolutely. In primary care, I think this is what got me more into functional medicine, was that in primary care, in my experience, 80% of the people didn't really need medications. You don't really need a synthetic drug to do this. If you get outside, breathe fresh, clean air, change your diet, more whole foods, more vegetables, more fruits, exercise, get moving. Those things are so important. And in traditional medicine, obviously those are always going to be important. We know they're important. But in 85% of the patients that I had, I say, hey, your hemoglobin A1C, which, we measured looking at a precursor to diabetes or diagnostic for diabetes, say, hey, this number is getting to this. Change your diet, get outside, move more, do these things. You can avoid medication. You can avoid complications. You can avoid these things with nothing, with just you. And I think, working in primary care, that was hard. That was a hard thing to get across to a lot of my patients.
Yeah. So what's your secret sauce on that? How do you do that?
Well, you got to be motivated. One, you've got, as a patient, we'll talk about it as a patient. So you've got to know, hey, there's an issue. I've got, X amount of weight that I need to lose, or I've got this issue that's creeping up. You got to be motivated. You got to realize it. So you got to be self-aware. And so me as a provider, I've got to make you self-aware, but I got to do it tactfully, and professionally, and say, hey, this is important. It's not only important for you, but it's important for your family. You can fix this now. You can do these things. And being motivational to them and saying, hey, this is what you can do. This is you can do this. This is how you can do it. Give them what they need, the coaching that they need, but they got to be motivated to do it.
Do you ever run across situations where you're not going to prescribe, you've given them a roadmap to get better, where they got to do the work and they're not happy with you?
Yeah, that's what I'm saying. That was a big issue. And people in general, I think, I'm paying you for a service. I want to get something back, and there needs to be something tangible. Where I went to the doctor today, they didn't give me anything back. They didn't give me anything. I didn't walk out of the office with something tangible. That's for some people, that's a hard sell. But I think it's really important if you educate them and you talk to them and you spend the time to sit down and tell them exactly what they need to do. And maybe that's even, write them out, a macro, a schedule and, a minor, exercise routine, and you give it to them. They walk out, they've got something. They don't have a synthetic drug, but they have something. And so I think that leaning towards that is what I try to do in primary care for the most part, is try to do that initially. Obviously, medications are extremely important if you've got something that's extremely pathologic. I mean, obviously antibiotics, obviously, if you've got some significant hypertension and you've got some outlandishly high cholesterol and things of that nature, yeah, you might need some medications to kind of get you through. But if you start doing these things in your life and implementing whole foods and natural things in your life, exercise. There's nothing more important that you can do for your body than just exercise. But if you do these things, eventually maybe we can get you off these medications. And so that was another avenue of approach too.
So before you came to Optimal Bio, how many jobs did you have as a practitioner?
I've done a lot. I did, emergency medicine. Urgent care was the longest stint that I did. Me personally, I think we all kind of have our own personal things in medicine as providers that we kind of get interested in. And for whatever reason, maybe it's a selfish reason, maybe it's a family member who has an issue, maybe your family member has some form of cancer, whatever you want to get into oncology or whatever. For me, I was a big runner. I ran for many years. I did a lot of marathons, Boston a bunch of times, did some ultras, was always really highly active in that and loved that. It was a passion of mine I had for decades. And just one day I went out for a normal run, normal jog, and I stepped in a hole kind of weird and pretty much destroyed my knee. And I didn't tear any ACL, MCL stuff, but all my cartilage. So I tore the meniscus, also tore the articulating cartilage, pretty much have no cartilage on the medial aspect of my left knee, just from a little minor depression that I didn't see. So that got me big into, well, what can I do about this? How can I fix this? How can I research this and help others who have this issue too? And so I got into some stem cell research and started looking into that, platelet-rich plasma, those kinds of things. So that's kind of really one of the stair steps that got me into more functional medicine. And that stuff's really remarkable. Does it work for everyone? No, but does it help, and can it help people? Yes. And that's without synthetic drugs or without surgery. When you go and you tear a piece of cartilage. Pretty much what you're going to do is go and have what's called a cleanup, right? And so what is that? What is it when they go and clean it up? Well, they just take that portion out, kind of smooth it over. Sometimes you actually have to have that done, but most of the time you do that, you lost cartilage. You've lost more cartilage. And so that was kind of my big passion.
So you said you did an ultra marathon. I always wanted to do one, although I ran 2 marathons and I never got the euphoric, hey, I did that. I just felt like I was, the race stunk and took me forever to finish it. And then I was sore for the next week. And so my limit is half marathons now, but I read some cool books in the past about these guys and others just, running for 100 miles to the Death Valley and, through the woods of Tennessee and everything else. So describe to us your ultra marathon experience. Where was it? How long did it take you? All that good stuff.
Well, first of all, it's just truly remarkable what the human body can do and what you can endure if you put your mind to it. So a funny thing about that is, I'd run marathons and stuff and plenty of them before in the past and was getting relatively fast for my age and size, but tore up my knee. And the surgeon came in and said, we're going to remove this and do this, try to get you back to where you can walk okay, because it was that severe. But you'll never run again. You'll never run again. And that's that. And I said, okay, all right. So let's do this and I'll figure out the physical therapy and go from there. But so in physical therapy, I said in my head, I'm going to run another marathon, maybe a bunch more. I'm going to show them that I can do this. And so the physical therapy was, I had a microfracture procedure. I don't know if you're familiar with that or not, but that's where they go into the bone and they drill holes into the bone where it bleeds. And when it bleeds, you release stem cells, your own body stem cells. And then they put you in a continuous motion device where you kind of move, and that motion molds over that area of blade tissue and causes a scab, and it's called fibrocartilage. And so it kind of fills in that gap, so you have something. So it's something they do for a lot of athletes. But that's the procedure I had, and it's extremely difficult to come back from. It's just really, really hard. Anytime in your physical therapy treatment, if you hit that spot, you can tear that off, and then you just start back over. It's just all over again. So at any rate, I ran another marathon, didn't do so great, but I did it, and I was excited and kind of like, hey, in your face, but a friend of mine who does hundreds, I mean, this guy has done, I don't know how many hundreds. He's insane, but he called me up and said, hey, there's an ultra in Charlotte. You think you can run it? And I said, well, of course I can do it. And he said, okay, well, it's a 50 miler. And I think that would be a good place for you to just start doing ultras. And I said, okay, sure. I'll do it. They told me I'd never run again. I'll do it. And so signed up for it haphazardly, hadn't trained. And we took off that morning about 5 a.m., 50 miles. And I had assumed, if you've ever been to the Whitewater, it's at the Whitewater Center in Charlotte. If you've ever been to the Whitewater Center, there's a nice little kind of pea gravel trail that goes all the way around the outskirts of the Whitewater Center. And it's pretty flat, pretty easy. And I thought, that's what we'll do, so no big deal, right? So, 5:30 a.m. we take off, and the first thing we do is take a hard right down into the mountain biking trails. And so we're running in the mountain biking trails, and that's where the whole course was. The whole course is through the mountain biking trails, which is rooty, rocky, and just up and down, and just extreme elevation change, which I didn't even realize is there for the whole 50 miles. But if you do it in under, I think, 14 hours, which is not a very fast time, but under 14 hours, you'll get a belt buckle. And so, my goal is to do that. And towards the end of it, my knee was kind of talking to me pretty good. But long story short, I finished in 13 hours and 20 minutes. And so it's not very fast. But, hey, when I tell you you can't run again, you'll never run again, it was an amazing experience in my life. So I got my belt buckle hung up at the house.
That's pretty cool. So have you done one since?
I haven't done one since. Took a little while to kind of get over that one. I haven't done one since, so we'll see.
No. I'll do 50 miles on a bike, but I'm not doing a ultra marathon. I read somewhere. So your story kind of reminds me of David Goggins. I think he was a former Marine also, and
he was a Navy SEAL.
Right.
What a extremely motivated, just a motivational person, just an amazing person.
Yeah, I just remember him telling stories in his book about, I didn't train. I just went out and ran 30 miles. And then I think he overdid it, right? And he had something, some part of his body wasn't excreting a certain chemical. And he ended up going to the hospital for like a week and a half. And, if he ignored it a little bit longer, we wouldn't be talking about him today. Well, we would, but it'd be post-mortem. So some of these extreme guys get a little crazy sometimes.
Yeah, get a little crazy, get a little overboard, but I think it's just those, people that have been there and done those kind of things. I mean, it's just lets us know what you can do. I mean, anybody can do that if you just really want to do it. You can do it. There's nothing in this world that you can't do if you try hard enough.
Have you, when you were doing it, afterwards when you broke it all down, did you spend half your time running and half your time hiking, walking? If you had
during the ultra,
during the ultra,
I mean, those places back in there were so rooted out and rocky that there were places you literally just couldn't run. You had to kind of slide. There was one portion, every loop that I'd come to, I would just sit on my bottom and just slide down it because there's no way else I could get around it. My legs were so smoked at that point that if I tried to control myself down it, I was done. So I have never fallen so many times in my life than doing that trail. You'd be jogging along and, your legs get so heavy that you just hit a root, boom, you're down. And like, oh man, let me get up. So it was pretty interesting. So it's a really hard one. So if anybody wants to try, to get into ultras, they have a 50K, I think, to start that, but it's a very difficult one, but it's a good entry point. You do that one, you can do any of the rest of the ones. I don't see how much harder it could be physically.
50K is 30 plus miles. That's even too long. So how did you get to Optimal Bio?
So doing PRP and stem cells, I was looking into functional and holistic medicine to be a provider to do that. And actually got a message and said, hey, have you thought about doing functional medicine full time? And I said, yeah, I have. So here's a company that's going to be coming into Charlotte or has come into Charlotte part-time, and they're looking for a provider. And so I applied, and man, I'm so happy to be here. It's just, it's amazing. I mean, Dr. Brandon, everything that he's taught me, I've learned so much in the past. I've been here for almost 5 months now, but just in that 5 months, man, I feel like I've learned so much more just about the whole body. I mean, there's just so much more about supplements and plants and things that you can take and that help with this ailment, that ailment. It's phenomenal. I'm so happy to be here.
Yeah, I said it was a month when I started the podcast, but it seems like a month, but it's unbelievable. You've been here for 5 months. What was your knowledge of testosterone prior to coming in?
Yeah, so personal experience, coming out of the military and being really active and being fit, and even the fire service and all these things always had to be a very kind of physical, and I had to be on it. I had to be at the top of my game, so to speak. And so I could do things, but I just never felt quite like a lot of my colleagues. I mean, they would go through this training regimen, and they would, we'd all be kind of wiped out, but they'd kind of pop back up and be ready to go. And I'm like, man, something's up. And so I'm like, I don't know what's going on, but I went and talked to my doctor at the time. And it's like, yeah, you're low, your testosterone is low, which I had to ask for to be checked initially. But yeah, it is low. So let's start you on testosterone injections. And so I did the injections first. And so doing that, obviously I felt better, but I'd have highs and lows. I would just feel really good for 2 or 3 days, and then I just feel down in the dumps for 2 or 3 days, and I just never could get that kind of planed out. And then obviously with meeting Dr. Brannon and getting in here at Optimal Bio, I really didn't know much about pellets. Especially, I knew bioidentical and I knew about it, but I didn't know that much. And then we started talking about getting me switched over to pellets, and we did that. And man, it's been a tremendous benefit. It's been night and day.
Yeah, I mean, I didn't know much about it either, and my wife went on it and changed her, and she convinced me to give it a shot. And 3 years later, I'm glad I did. Why is the traditional medical community that you were a part of for a number of years, I wouldn't say they're against testosterone, but why don't they reach out and learn more about it?
Well, it's a difficult question to answer. I think some are all on board, some aren't. And, it just goes back to those findings in the studies in 2002, 2005, where, for example, estrogen causes breast cancer, testosterone causes prostate cancer, which is fallacy. It's not true. So it's not true with bioidenticals. It's just not true. So I think that they kind of stick to that. And then also, when I'm speaking from hypothetically, if you work for a certain entity, you still got rules and you got policies and procedures that you have to follow. And if you fall outside of those, it's not good for you. So I think that a lot of them are trying to learn more about it. Some of them aren't. Some of them are just going to be against it forever, I guess. But it's a hard question to answer, really.
Did you have any apprehension about? Not only, I mean, obviously you received the pellets as a patient, but now you're going to give the pellets, you're going to place in humans. How was your confidence level on that?
Placing pellets, a tiny bit anxiety provoking initially, I'm not going to lie, but working in emergency medicine and doing stitches and sawing up chainsaw accidents and just things of that nature, doing the actual procedure wasn't that big of a deal. But you just always, I think if you really care and you're passionate about your job and passionate about what you do, I just really, more than anything else, the anxiety comes from, I want them to have a good experience. I want to, obviously, first of all, I don't want them to have any pain, right? And so I want to place it in there where it's not painful, and then they feel better, So I think that's the most anxiety-provoking thing is, like, I hope this works great for them, and, you just really want that to work out.
Yeah, I think one of your goals in placing would be not to get the call, a week later saying, "Oh, my site still hurts. It's swollen. It looks like there's some fluid coming out of the site." That's obviously something you don't want to do. So, Right.
Well, luckily we lose less than 1% of pellets, so that's something that's good with Dr. Brannon's procedure. I mean, he, as a nurse practitioner or physician assistant, he thoroughly scrutinizes us and puts us kind of through, we do, probably 100 placements before we're allowed to even do it without him in the room. I mean, he's very meticulous, very step by step, and he's found a procedure over the decades it's worked, and it's proven. And so that's what he does for us, and make sure that we know that ins and outs before we even attempt to do a placement.
So you were a user of the shots for a period of time, and obviously you talked about the ups and the downs, and the fact that you got to repeat that shot on a weekly basis. I think in addition to that, you're in the medical community, and probably giving yourself a shot, or your wife's a PA, her giving you the shot. That's obviously not that big of a deal. Have you run across patients, though, that have been so used to being on the shot that they're not convinced that the pellet is going to be better for them? And if you have run across that, what are some of the things that you communicate to them to make them feel better about giving this a try?
Yeah, I mean, I think it's big for me too, is, hey, I feel comfortable giving an injection to myself. I've done it, thousands of times in practice. I can do it myself just fine. But going to a pellet, you feel like it's a much bigger procedure, but it's really not. It's one, and you're done for 3 to 6 months. When you're doing injections, you're giving yourself an injection if depending on who your provider is and managing it, things of that nature, once a week or every other week. And so every time you give yourself an injection every week or every other week, you're increasing your risk for infection if you mess up, right? And then you're increasing your risk for misdosing. You pull it up and the vial's pretty small, and it's kind of hard to say, is this 100 milligrams or is this 120? It's really hard to get that perfect. And then, with pellets, you don't have to worry about that. And that's been the biggest thing. Well, one of the big things for me. Obviously, I feel a lot better on them. I'm a lot more stable, sleep better. There's just so many things have changed for me. But I think, when you're going back to the pellets, when you put the pellets in, you do it once, you're done for 3 to 6 months. You don't have to worry about it again. Yeah, you might be sore for a couple of days, but that's nothing. I don't have to give myself a shot every week, Yeah,
I got a friend of mine that's on the creams. I don't know if you've ever experienced them before, but obviously that's a painless application, but the flip side, it's inconvenient. You can't touch anybody for a while. You can't, use a towel. You can't take a shower. You can't go work out. You got to wait for, that cream to absorb, and then you got to do that every single day as well. So to your point, I think from an application standpoint, the pellets are certainly the way to go. And then obviously there's this great debate with. We use bioidentical at Optimal Bio, and then obviously there's a synthetic testopel hormone that's out there as well, a pellet that's out there as well. Some of your patients ask you about the difference between both of those, or is that something that's not really discussed too much?
I think most of the patients that come here are already on board with bioidenticals. They already know that that's the way to go. That's the safest option, and all the research and data suggests that. And they're pretty on board already before they come in. I don't really have that one so much, but out in town when I'm talking to friends, colleagues, firefighters, young ladies who may be experiencing perimenopause, menopausal symptoms, just talking to them about the differences, right? So my conversation with the guys in the cream is like, I've got daughters. I can't be worrying about, in the back of my mind, oh my gosh, did I wash my hands really well right after I did that, before I hugged my daughter, before I went out the door, those things. And that's extremely important. I mean, you're going to affect other people with that, and then the creams just don't get you up kind of high enough. I mean, and you want to talk about shots being once a week or every other week, doing that amplitude and depression and wave of dosage, every day. So, in the morning you put your cream on, that afternoon you're already back down, right? And the next day it's all over again. And then I got a lot of, I know a lot of people that they're in the fire service and things of that nature where you're sweating a lot, you're working hard, right? And so you apply that cream, and then, you get outside and it's 96 degrees like it's going to be here today in Charlotte. And, what's the efficacy of that? Is it going to work or not? So it's just the pellets it's just really the way to go. And then all my research that I've done, I scrutinized all the papers. I did everything first because it's my own body, right? I want to make sure that I do the right thing for my body. I want to advocate the right thing for my patients, and I think it's extremely important that that's the way that I went. So I'm not going to advocate anything to you or your family member that's not unsafe or that's not been thoroughly scrutinized. I have done all the research, and that's what brought me to do it this way.
So let's go back real quick to your, workout routine these days. Obviously, probably a little bit less running. So what does it look like? What do you do? Walk us through Monday through Saturday.
Yeah, so Monday mornings I do get up at 5 a.m. and I know I sound crazy, but I get up at 5 and I'll go for a run. I'll run for an hour and then come home, get ready. And then I try to eat or worry about what I eat, right? So you can exercise till the cows come home, but if you eat 4 pieces of pizza after your 10-minute jog, it's going to ruin it, right? So at any rate, back from the run, I'll eat berries, and I'll eat a bowl of berries. I don't really weigh them out, do all that kind of stuff, but I'll have a bowl of berries and I'll have eggs. And so I've got, vegetables or fruits, and then I've got some meat, right? And then on Tuesdays, I'll lift, and then I'll do, right now I'm currently doing an upper body, lower body split. So Tuesday will be my upper body. Wednesday will be another 5 a.m. get up and go run for an hour. And then Thursday is the lower body, and then I kind of just alternate that. And then on Saturdays and Sundays, depending on how I feel, I'll do kind of a speed day for my run, which a speed day these days is highly subjective, but faster than normal, faster than what I typically do. And so you just got to, I feel like, obviously everything that you research, everything that you look at, there's nothing more important than getting your body moving.
So Friday's your day off then?
Fridays typically be my day off.
Yeah, mine's Sunday.
What do you do? Are you biking a lot?
I'm reversed from you. So I'll lift Monday, Wednesday, Friday, and then I'll cardio Tuesday, Thursday. Most of the time it's a run. This time of year, I'll probably mix it up a little bit because the mornings I get up same time you do, and it's lighter earlier. So I might go for a bike ride because that takes more time than a run sometimes. And then thankfully I'm near a pool, so I can get back into the pool. And so summertime, I try to mix it up when I do my cardio with those three things. But for the most part, it's a run, and I'm not spending an hour running unless I'm training for something. I do about a little bit over 4 miles every time I go. And to your point about speed, I do that every once in a while, but I feel like I'm walking when I think I'm running full speed. So
it's all subjective. That's just how we feel.
It's like the guys walking in front of me, I think I could catch them, and I do catch them eventually. But I think 20 years ago I could catch them a lot faster. So, one of the things I think we've come across at Optimal Bio over the years is, I think a lot of our patients recognize the benefits of, hormone treatments. But I think some of them, not all of them, and some of them take the benefits as that's the only thing that they're going to do or have to do in order to drop weight, if that's a goal of theirs, or to gain more muscle mass, if that's a goal of theirs, or to have better sleep at night or whatever. And I think you hit the nail on the head earlier, and you probably run across this thing in some of your consults as well. It takes not only the hormones, but it's all the other things in conjunction as well. So how do you articulate that where you can hopefully get them motivated to do that?
I think Dr. Brandon says it perfectly. You're a Jaguar. You've got everything you need. We just need to give you the gas, right? And so that being said, everybody that comes in here, they may not be where they want to be physically or emotionally or whatever. But we get you optimal hormonally. We balance everything out for you. We get your body working, and then maybe you'll feel better, and you'll feel a whole lot better enough to where you want to go out and do these things. So it's a combination, absolutely a combination of the two. But when you come in and your testosterone's in the tank or your estrogen's in the tank, and you got these things going on, your thyroid is wonky, you're not going to feel like going out and running 3 miles. It might kill you, right? I mean, it's going to hurt, right? So once you get those balanced out, then if you want to get completely optimal, we'll give you everything you need to get there. Then you've got to take the responsibility to get and sharpen the sword, so to speak.
Yeah. This has been great. Usually we end with the guest. In this case, it's you, even though you're part of the family. Partaking, what we call 5 takeaways or 5 pieces of wisdom, to our listeners that work for you. So what would they be?
5 takeaways as far as health goes, I would say the biggest thing is eat fresh whole foods, right? So fruits, vegetables, lean proteins of your choice, whatever, your philosophy is on protein, get those, but get them from whole natural sources, organic sources. We talked about that already. Exercise, right? Get out, get moving, enjoy your life. Exercise doesn't have to be something that you just have to do because we tell you to do it and it's good for you. Find something that you enjoy. If it's get out and a hike, get out and enjoy it. Go enjoy nature. Get outside, enjoy Mother Earth. Do something. Get moving. Try to eliminate the negative things in your life. What's holding you back? Identify those. Say, hey, I always have this excuse. I've got this going on. I'm so busy. I've got this and that. Hey, you only live once. No one's going to do it for you. Get out there and do it. you're going to look at yourself now, look at yourself in 5 years, look at yourself now. Are you balanced? Are you sharp? Are you changing? Are you making those changes in 5 years? What's the difference going to be? Make those changes, identify those issues, attack them head on, go full force at them, and make those changes. I think next is whatever your family is, no matter what your dynamic is and where you are in life, get good people around you. You can call them your family or whatever you want to call them, but good, positive influences around you. If there's anyone that's negative, there's anybody holding you down, eliminate that from yourself. Be around people who are positive. Be around people who are motivated. Find out who's more successful around in your circle and spend time with them. What do they do? Like Jim, he gets up at 5 a.m. and he goes for a 4-mile run, 3 or 4 days a week, or he goes for a bike. What is that? Why is that different? Does that make him? Well, maybe that's where his head is clear. That's what clears him up, right? And that's what gets him going. And that's what gets him motivated. And that's what makes him think maybe outside the box, or makes him do things that make him more successful. And at the very end, my fifth thing is really just the golden rule. Treat everyone like you want to be treated. If you treat everyone like you want to be treated, the whole world will get better. Not just us specifically looking back into ourselves and the selfish meism. I want to have this. I want to look like Superman. I want to be like this. I want to do this, whatever. I. The only way you can truly be really happy is to give your love to someone else, right? If you give your love to someone else, then you become happy, right? You got to be able to do that. And that the basic thing is just the golden rule. Abide by that. Live it, breathe it. Say, hey, this guy just cut me off in traffic. I've got 17 minutes to get to the office. This is not the day to do it. I'm not the guy you want to do that to. This is not happening. Do you get out of your car and you go look crazy? No. Wave at the guy. He could be going, you have no idea. He could be going to the hospital having some kind of significant issue going on. So just the golden rule. Remember the golden rule.
Great advice. Johnny, thank you for your time today.
Thank you so much, Jim.
Look forward to continue working with you and keep up the good work.
This has been a production of Optimal Bio. Optimal Bio is CEO Tyler Brandon, podcast host and partner Jim Baker, medical director Greg Brandon, production assistance by Core Media, Beth Grabencourt, administrator, Kevin Duthu, executive producer. The podcast can be found on our website, optimalbio.com, on Apple Podcasts and Spotify. Our theme song is Sunwave by Paradiso, provided by Epidemic Sound.